Welcome to The Explainer. Today, we're diving into the world of oral surgery, but probably not the way you're thinking. We're going to pull back the curtain on that super critical first step, the diagnosis. Let's find out what's really going on. You know that feeling, right? Something just feels off in your mouth. Maybe it's a nagging pain, a weird lump, or something else that has you worried. So you go to the specialist. But what actually happens between walking in the door and getting a clear plan? It's not magic, I promise you. It's actually a really methodical investigation. And the best way to think about this whole process? It's like a detective story, a medical mystery where every single little detail is a clue that helps crack the case. And this, right here, is the key thing to remember. This whole thing isn't just something that happens to you. Nope, the surgeon might be leading the investigation, but it's your story, your symptoms, your input. That's the number one piece of evidence. You're an active partner in this thing right from the jump. Okay, so every good investigation has to start at the scene of the crime, right? Well, for our dental detective, that means a really thorough physical exam. This is all about gathering those first, most fundamental clues. The detective's work here is split into two main parts. First, outside the mouth, they're looking for any external signs. Is your face symmetrical? Is there any swelling in your neck? They'll gently feel around your lymph nodes and check how your jaw is moving. Then they move inside for the intraoral exam. And here, they're looking at everything. Your gums, your soft tissues, checking for tiny fractures in your teeth, looking at the bone underneath. Every single observation is another clue on the board. But physical clues only tell part of the story. To really see what's hiding beneath the surface, our detective needs to break out the high-tech toolkit. And what a toolkit it is. I mean, we're talking about all kinds of imaging, like your standard x-rays, but also these super powerful 3D scans. Then you've got lab tests that give a snapshot of your overall health, tissue samples or biopsies for a look under the microscope, and even vitality tests to see if a tooth's nerve is still healthy. Each tool is picked for a very specific reason, to help answer a very specific question. So one of the most powerful gadgets in this whole kit is the cone beam CT, or CBCT for short. Think of it this way. A normal X-ray is like a flat photograph. A CBCT scan, that creates a full three-dimensional model of your jaw, teeth, and facial bones. It lets the surgeon spin it around, look at it from any angle, which is, you can imagine, a huge advantage. But a heavy hitter like a CBCT isn't something you use for every single case. It's all about balance. It's absolutely essential for complicated stuff, like planning an implant down to the millimeter, getting a good look at a complex jaw fracture, or figuring out exactly where that impacted wisdom tooth is hiding. But like any powerful tool, there are trade-offs. It does involve a dose of radiation, less than a big medical CT scan for sure, but more than a little dental X-ray. And sometimes, metal fillings or crowns can create little distortions in the image. Now, the investigation isn't just about what's happening inside your mouth. Your entire body is part of the story. To make sure that any treatment is going to be safe for you, the detective needs to check out your systemic health. And for that, blood tests are absolutely key. So what are they actually looking for? Well, each test gives them a vital piece of the safety puzzle. A complete blood count, or CBC, can flag things like an underlying infection or anemia. Coagulation studies? Super important to make sure your blood will clot like it's supposed to. And then you have tests for blood sugar, liver, and kidney function, all to make sure your body can safely handle the stress of surgery and any medications. It's all about building a complete safety profile. And this is why it matters so much. Going forward without this info is like a detective deciding to just ignore a key witness. It's just incredibly risky. We're talking about the potential for excessive bleeding, really poor healing, a much higher risk of infection, or even complications from anesthesia, all because a crucial piece of the puzzle was missing. Okay, so our detective has gathered all the clues. They've got the physical exam notes, the high-tech images, the lab reports. Now comes the real brain work, putting it all together to solve the case. And this process has a name. It's called differential diagnosis. It sounds fancy, but the idea is actually pretty simple. It's just like in a detective novel. It's a process of elimination. A good surgeon doesn't just jump to the first conclusion that pops into their head. Instead, they make a list of all the possible suspects,
all the conditions that could be causing your symptoms. And then they systematically rule them out one by one based on the evidence.
Let's break that down. Step 1, list the possibilities. Is that lump a simple cyst, an infection, or something else entirely? Step 2, analyze the clues. What does the CBCT show? Is it filled with fluid? Do the blood tests point to an infection? Step 3, rule out the imposters. Okay, if there are no signs of infection, an abscess becomes way less likely. And finally, by scratching off everything it isn't, they can confidently point to the real culprit. The case is solved. The diagnosis is made. But the story's not over. Actually, this is where the most important chapter really begins. It's the partnership between you and your surgeon, and it's formalized through something called informed consent. A diagnosis should never, ever feel like someone is just handing down a final verdict. It's not. It's the key piece of information that kicks off a conversation about what to do next. It's that moment when the detective lays out their findings, and you, the star witness, get to decide on the plan together. You see, a proper informed consent process isn't just a piece of paper, it's a structured conversation. The surgeon has to clearly explain the diagnosis, the treatment they're recommending, including all the risks and the benefits. And they must talk about the alternatives. What if you did a different treatment? What if you did nothing at all? They should be encouraging you to ask questions, and this is critical. They should check that you understand it all before anything gets documented. And remember, you have rights here. You have the right to ask every single question you can possibly think of until you feel satisfied. You have the right to go home and think it over. You should never feel pressured to make a decision right there on the spot. And you absolutely have the right to change your mind and withdraw your consent anytime before the procedure actually starts. This is your health. It is your decision. And this is really what it all boils down to. Informed consent isn't just some legal form you have to sign. It is the ethical bedrock of the entire doctor-patient relationship. It's about respect, it's about trust, and it's about recognizing that you are the final authority when it comes to your own body and your own care. So from that very first clue all the way to the final partnership, that's the real journey of an oral surgery diagnosis. It's a detective story where you get to play a starring role. So the next time you're in that chair, you'll know exactly what's happening and why. And the only question left is, what will you ask to help solve your case?